India is not only struggling to treat COVID patients, but now several states are also facing shortages of medicines to treat a rare and fatal infection. Black fungus, also known as mucormycosis, is caused by mold that's found in wet environments and can attack the respiratory tract. Medical experts say the disease seems to be affecting some COVID-19 patients and those with underlying conditions. Some have also said it may be linked to humidifiers used to deliver oxygen. At least 90 deaths have been recorded in the western state of Maharashtra, including Mumbai, and another 800 people are currently hospitalized with the disease. Well, let's now bring in Dr. Akshay Nair from Mumbai. He's been treating patients suffering from this black fungus in India. Doctor, thank you for taking the time to be with us. I see the government there has been putting out warnings, as has the Medical Research Council there. Just how widespread is this?
Well, to give you an idea, till about last year, we would see less than 10 cases in an entire year or two. But since January of this year, we've seen more than 50 cases in a single hospital. So the number of cases has really risen, and it seems to be affecting a specific group, like you mentioned. These are patients who've recovered from COVID or are recovering from COVID and have underlying diabetes. So it really is complicating things, because just when they think they've recovered from one illness, an equally serious one seems to be catching up.
Of course. I mean, there have been such terrible shortages of medical oxygen in India. We've been reporting on those for weeks now. Has this all come about because people have gotten desperate and are taking whatever supplies they can get? Is that how people are getting sick?
No. So typically mucormycosis, like you said, is a fungus or a mold. And this would only infect people if they have an underlying condition that weakens their immune system, something such as diabetes, or if someone has undergone an organ transplant, then they receive medications that suppress their immune system, like steroids. Now, a lot of people who've been suffering from COVID have received steroids during the course of their treatment because it's a life-saving drug. But the exact amount of dosage and whether the use was required or not seems to be a little dodgy, because a lot of people have been self-medicating. One of the complications of these steroids is that it pushes up your blood pressure, blood sugar level, makes you diabetic, and therefore makes you more vulnerable to infections like mucormycosis.
Well, Doctor, I was looking at some of the mortality figures for this, which can be as high as 80%. That sounds terrifying. I imagine this is only adding to fear there in communities. Can you explain how it spreads and potentially how people can try to protect themselves if they do have an underlying condition?
That's right. It does have a high mortality rate. Typically, this disease starts in the nose and then enters into the spaces around the nose called the sinuses. And from there, if it is left untreated, it then progresses to the space around the eyes. At this time, people typically get symptoms of blurred vision, double vision, inability to open their eyes, and soon then they lose their eyesight. And if at this stage it isn't treated, which is typically a mutilating surgery that involves removal of the eye, it then spreads into the brain. It's only in this subset of people where the infection has actually reached the brain do we see such high mortality numbers. This can be treated and diagnosed early, especially if it is restricted to the nose and the sinuses, or even up to the eye, where a surgery can be curative. The problem that we seem to be facing currently is the severe shortage of the drug amphotericin B, which is required for the care of these patients. I wouldn't want to have people panicking about this, but not everybody who's had COVID needs to be worried about this. If you are a diabetic, if you've received a course of steroids, and if you've recovered from COVID, only then would you want to be a little more alert towards the symptoms. Getting your blood sugar checked would be a good thing to start with, because one common thread across all our mucormycosis patients is an elevated blood sugar level. Other early signs would be swelling of the face, tingling and numbness on one side of the face, pain around the nose, around the eyes, and finally, like I mentioned, blurring vision issues and drooping of the eyelid, etc.
Doctor, just very briefly, I do want to ask you, because we are living in the middle of a global pandemic, should other countries and people there be worried about similar opportunistic infections?
In terms of this disease being contagious, this disease is absolutely not contagious. Mucormycosis cannot spread from one individual to another. Like I mentioned, it requires a lot of factors to be in the right place at the right time for a person to be get infected with this disease. So as long as people are monitoring their health, their blood sugar levels, and reporting to doctors at the earliest sign of anything suspicious, they should be safe. These cases have not been reported in as high numbers from other countries that have had the pandemic.
Dr. Akshay Nair there from Mumbai, who's been treating patients suffering from that black fungus in India. Thanks so much for taking the time to be with us, and we wish you all the best with your work, Doctor.
Thank you so much.